My name is Rosemary Perry. Today I'll be discussing type 1 diabetes. The website beyondtype1.org states that approximately 1.25 million Americans have type 1 diabetes. When I was 7, I was diagnosed with it, and it affected the entire family. It was difficult to cope with the fact that I had to check my blood sugar, prick my fingers every time I ate, and also take injections every time I ate anything. Diabetes can affect anyone. Type 1 diabetes now is being diagnosed at later and later ages than it was when I was diagnosed. I have a good friend who was diagnosed at the age of 20. The topic connects with me because I have it. I live with it every day. And through the years, my family and I have tried to stay up to date with the advances that they come with in the diabetes world. First, I will briefly cover the discovery of type 1 diabetes and the early tests for it. Secondly, I'll discuss the general maintenance of this disease and the consequences that come with poor management. And then I will explain the difference between type 1 and type 2 diabetes. The early tests were kind of unusual. The earliest mention of diabetes was in ancient Egypt papyrus, and that's from beyondtype1.org. In the beginning, physicians used a method called uroscopy, which was examining the urine. One of the first tactics they used was to taste the urine, and if it tasted sweet with people that already had diabetic symptoms, they would go ahead with treatment. Beyondtype1.org says that in 1915, before the discovery of insulin, diabetic specialists would often promote an extremely low-carb diet and prolonged fasting to maintain the symptoms, minimize the symptoms. In 1916, the first tests they did were on extracts of pancreases from dogs, which then led to successful treatment in humans with type 1 diabetic symptoms. And then finally in 1963, insulin became the first human protein to be synthesized chemically. We've covered the early history of diabetes. The next step is to talk about the maintenance and the consequences of type 1 diabetes. Maintenance can be complicated and overwhelming. Poor maintenance can result in complications with your eyes, your skin, feet, kidneys, your blood pressure, and it can even cause a stroke. Skin complications can include bacterial infections such as styes, boils, folliculitis, which is an infection of your hair follicles, or carbuncles, which are deep infections of the skin and the tissue underneath, or an infection around the nails. That's from the American Diabetes Association. Diabetics are also susceptible to a variety of foot problems, such as neuropathy, ulcers, poor circulation, and even amputation of the feet. MayoClinic.org outlines the basic type 1 diabetes maintenance as insulin, frequent blood sugar monitoring, eating healthy, trying to keep an active lifestyle, and maintain a healthy weight. There are 5 types of insulin that they use to treat type 1 diabetes. That's going to be rapid acting, short acting, intermediate acting, mixed insulin, and long acting insulin. All of those refer to the amount of time it takes for the insulin to take effect on the blood sugar, as well as how long the effects last, except for the mixed insulin, which is just going to be your insulin that you have to mix with another insulin for it to be effective. The basic maintenance of diabetes sounds a lot simpler than it is, but it's also important to know the differences between the 2 main types of diabetes. Healthline.com says that both are chronic diseases that affect the way the body regulates sugar. And type 1 diabetics do not produce insulin. Type 2 diabetics don't respond well to insulin and may at some point in life stop producing insulin completely. And type 1 diabetics, Healthline.com, says that the immune system attacks and destroys insulin-producing beta cells in the pancreas, and once those beta cells are gone, you can't produce insulin anymore. They don't come back. One of the big differences is type 2 is a lot more common than type 1 diabetes. Among the approximate 30.3 million people, 90 to 95% of those have type 2 diabetes as opposed to type 1. And in conclusion, we talked about the discovery of type 1 diabetes, the maintenance and the consequences of poor management, as well as the differences between type 1 and type 2. In closing, I'd like to say that type 1 diabetes can be hard to live with, but with the help of good family and friends, it gets a lot easier, and hopefully one day we can find a cure for it.